Next speaker we have is Dr. Ricardo Perez-Nunez, who is the Director of Injury Prevention at the Secretariat of National Council for Accident Prevention in Mexico. Dr. Ricardo has been a long-term collaborator with our injury unit, and we are very glad to have him back and talk to us a bit about his work in Mexico.
Thank you very much, Dr. Gupta. And I would like to start thanking Dr. Hernan Haider for the invaluable invitation that he made to me, not only to attend this presentation, this symposium, in which many people, experts from all over the world are presenting and sharing their results and advancements, but also for having the opportunity of present this evaluation of the Global Road Safety Program that we are all doing together for Mexico and in Mexico. So background information, when we talk about the IMSEVI, we refer to the Mexican Road Safety Initiative, which was funded by Bloomberg Philanthropies with a very close collaboration with WHO and PAHO authorities in order to develop a very comprehensive and with a kind of a system approach to road safety for the country. We can say that the first phase of this initiative started in 2008 and focused on 6 different risk factors: drinking and driving, seatbelt, child restraint, speeding, helmet, and pedestrian safety. Although we need to acknowledge that most of the work has, from the very beginning, been focused on drinking and driving and seatbelt use. And the other risk factors are actually not targeted for very effective interventions, but these two have been somehow being targeted. Interventions include training of road safety professionals, increasing awareness through specialized forums and workshops, talks to youth, children, social media campaigns, promotion of law improvements, road safety audits, promotion of alcohol checkpoints, etc. It started into this first phase in 4 cities, and then the second phase, which is now what is called the Global Road Safety Program of Bloomberg. It started in 2010, and it only focused on 2 out of the 4 cities, the initial ones. And although it kept working on the 6 risk factors as part of the IMSEVI program, it also focused on drinking and driving enforcement and promotion of seatbelt and child restraint use in the cities of Guadalajara, Zapopan, and León. Starting in 2013, the authorities tried to scale these, I don't know if I should say unsuccessful interventions to other 4 cities. And this was not done properly, and we need to acknowledge that this is a lesson that we should learn, that once you have something very well integrated, it's when you decide to move forward and then scale this type of programs. I need to say that in parallel, the IMSEVI activities were and are still being promoted across the country. And particularly one of the things that I'm glad to share with you is that the alcohol police checkpoints are being very much promoted across the country. And we started before 2008, less than 10 municipalities were doing alcohol police checkpoints. And now, at the end of 2014, we are almost reaching 100 municipalities. So there has been a huge increment in the alcohol police checkpoints across the country. Of course, the intensity in which IMSEVI activities are being implemented and the success they have been achieving has been different depending on the states and the cities in which they are being implemented. What I'm presenting today is actually an extension of the work that we have been working, and we have published in 2 different areas. The first one is quantifying the underestimated burden of road traffic mortality in Mexico, which could be as high as 30%, depending on the year or the method or approach that it could be used in order to account for these so-called garbage codes. And the second, it's another, oh, by the way, that paper is accessible in the Traffic Injury Prevention Journal that you will have there, the special issue. And the second one, it's a paper that we just published early this year in the PLOS ONE journal, which accounts for the early impact of a national multifaceted road safety intervention program in Mexico, in which we carry on a time series analysis of outcomes. Taking that as a route, we are adding value by incorporating new population estimates, which we found out that the Mexican government based the population estimations on were not very much successful, so they need to rerun those estimations, and they were made available to us just a couple of months ago, which this somehow changes the denominator, because it used to be underestimated, and now the mortality figures look higher than they are with this new estimation. It also uses adjusted mortality figures. The paper that was published uses crude mortality, which didn't account for this underreporting. So we are now using the approach of the multiple imputation of those garbage codes. So it's a more realistic figure of mortality with these 2 changes. And it now includes information of 2012, which is the more recent information on mortality that we have available. This, of course, is a continuation of the monitoring and evaluation effort as part of the Bloomberg's Global Road Safety Program in Mexico. So it's part of the multi-collaborative effort between Johns Hopkins and the National Institute of Public Health, Fundación Entornos, and now with the Minister of Health, where I'm happy to work right now. This is a plausibility evaluation of the early impact of the first and second phases of the IMESEVI. We conducted a time series analysis using ARIMA models for 3 indicators: mortality rate, injury rate. Just consider that this injury rate was taken from police reports and only for urban and suburban areas. We don't have access to federal roads, so we don't have that other information, and we know that on huge highways is where many of the deaths and injuries occur in the country, but we don't have yet that information. We're working hard to obtain it. And also the collision rate, it's also taken from police reports and for these areas. So taking that into account when we interpret the results of this approach. The information started in January that we have and we analyze, starting in January 1999 and is up to December 2012. We decided what was the best ARIMA model using the ICAICE information criteria, and we evaluated the residuals using different tests and these different approaches. Here you have the time trend of the annual road traffic death rate using the corrected one from all this period. And here you can find the countries, this is the country's mortality rate, that you can see that at the end, it's kind of stable during the completion of this time. But if you pay a little bit more closer attention, you can see that it started in 2004 and up to 2009, it was like a slight increment that is shown here. And then after 2009, this is being reduced. So the first question is that statistically significant? Can we say that something happened after 2010? And the other thing that we can see is that in the city of León, there has been a reduction of this trend, of this mortality death rate across the whole period. So if we only start looking at information from 2008, we can wrongly assume that these two interventions have worked well because there is a clear reduction. But what we can see when we expand this is that the mortality was already being reduced, and we don't know what was going on in the city. So can we really claim that this is an actual success of the RS10 project or the IMSEBI project? Something that we should reflect when we analyze this. So we converted these mortality figures by monthly road traffic death rate, which we further analyze using the time series analysis. So here are the results. And as you can see, there is no reduction in any of the two cities. So this is not statistically significant because of the reasons I more or less mentioned before. But what really struck me is that we see that Mexico death rate is reducing. And it's probably now that I've been more involved with the Minister of Health that we can say that maybe the expanded police alcohol checkpoints are kind of working at a very larger scale, but it's something that we need to figure out with more detail in the future. So starting in 2010, it's a significantly less mortality death rate than before, and even is lower than the starting in 2008 when the IMSEBI started. When it comes to road traffic injury rates, one thing that came to my attention is that in the city of León, we saw this dropout during this period, and we saw this increment earlier on. So one thing that easily comes to my mind is that there could be some recording issues that doesn't allow us to come up with a very good conclusions using this police information just for the case of León. But if you see at the country level, you can see that it increased up to a point of 2007, and then it started to decline consistently. This is the figures by month. And here you see that there is actually a reduction starting with the IMSEBI in 2008 at the country level in terms of the injury rate. And it reduced further in 2010 when the RS10 project started, which is actually significant compared to before 2008 figures. Nothing happens in Guadalajara, Zapopan. Nothing happens in León in terms of injury rates. When it comes to crash rates, you have a different scenario, and you see that apparently there is something that is happening also in Guadalajara, something that is happening in the city of León, and you can also see that a potential reduction in Mexico as a whole. This is the monthly collision rates, which also shows a similar pattern. And the ARIMA models tell us that there is a reduction in the collision rate starting in 2008, and this is somehow encouraging for us to keep working on road safety at a country level. Nothing happens again in Guadalajara, but in León we see that there is a decrement in the collision rate, although it doesn't translate in a reduction in injuries, which could be due to information bias, but also didn't translate in reduction of deaths, which is somehow disappointing at this point. So my conclusions could be that something is happening in Mexico that give us motivations to keep working and working hard to expand all the successful interventions. There is a lot of evidence at the world level that we could keep, pushing forward those interventions that are actually effective at the country level, and instead of focusing on less effective interventions as we have done in the past. So I think that it's now a great opportunity that we could show this and pursue at the national level to obtain more funds for this field, because we are showing some results, and we could show even more results if we get more political support and more funds to do our work. There has been some potential reduction that could be attributed to this program, but it's very hard to say it. We don't know exactly what else is going on at the country level. We don't know how many interventions are being put in place that could also have helped these figures to show those reductions. We need to further identify what could be working from what we are doing to expand it at the national level. For example, police checkpoint strategy. Maybe we need to work harder on that. There is a reduction of collision rate in León, which is encouraging, but we should also pursue that this also translates in injuries and mortality and deaths reducing. No changes could be demonstrated in Guadalajara, Zapopan as yet, although many of the good changes that have been put in place were developed in 2013, such as the new mobility law that was put in place. So we need to follow up this, and I put it here as a future step. We need to include 2013 figures, and we need to start thinking of the road traffic injury as different problems that are affecting differently pedestrians, motorcycle users, because not all of the interventions are affecting or could affect all the road users spectrum. So we need to disaggregate this analysis, and we need to do it by road user to see if these interventions are working on car occupants. For example, seatbelt use will not affect death rates in motorcyclists or pedestrians or so on. So maybe we could see an effect if we focus on car occupants. Time series analysis of national alcohol-associated crashes. This is an indicator that has not been analyzed yet because, for example, in Guadalajara and Zapopan, there is a lot of underestimation of these alcohol-associated crashes, but we could also do it in León, and we could also do it in Guadalajara to sustain the hypothesis that maybe the alcohol strategy is working on at the country level. We need to comprehensively understand and analyze the interventions that are being underway. As a monitoring and evaluation team, we didn't get access to all the activities that are being put in place in the country, which now I have access to that information, and we need to start, disaggregating this by interventions and maybe include some of them as covariables of these models so we can adjust and see what is affecting most these reductions or what is not. And other variables should be included in this type of models. We don't have information on alcohol consumption, which could also affect this, on other economic variables. So we need to do that in the future if that information is available. And we need to move from analyzing municipalities to better analyze metropolitan areas. because this is a metropolitan area problem, and focusing on only 2 municipalities of 8 that conform the Guadalajara metropolitan area could be misleading, as well as using only León in a metropolitan area of 3 municipalities. So we need to think bigger. This is a macro level problem. Efforts to improve systematic data collection are underway. We are collecting information through the system of drug use epidemiological system, which collects information from ER users, but also on autopsies that are done on injured dead people. And we need also to compile information that has not been previously accessed, like federal police information, this CISBEA information, as well as pre-hospital Red Cross information, which could tell us something for a period. I would like to acknowledge the support that I have received during very much of the time by Daniel Vera Lopez and Lourdes Gomez Garcia, which assisted me in data management and analysis, but also, and more importantly, that acknowledge that this is part of a collaborative effort between Johns Hopkins International Injury Research Unit, which is managed by Mr. Jeffrey Lunen, which I would like to acknowledge and thank all the work that he's doing with us. And then National Institute of Public Health authorities, Elisa is here with us. And all of this wouldn't happen if we didn't receive funds from the Bloomberg Philanthropy Global Road Safety Program. So I would like to acknowledge and thank all of them. Thank you very much for your attention.